Welcome to Under the Microscope. This series is brought to you by the Real Scientists Nano team. Our goal is to provide a platform where scientists can communicate their work and interact with the public. With that in mind, every week we introduce you to a scientist working in the field of materials and nanoscience, who would be curating the RealSci_Nano Twitter account. Hello everyone. Today we have with us Olga Shimoni, who is an associate professor at the University of Technology, Sydney. Olga, could you tell us how did you end up in your current research field?
Well, I've been since my young adultship. I've been always kind of fascinated about nanotechnology, and especially when you see in sci-fi movies idea of nanobots, those tiny devices that can be injected into your body when it goes to particular spot and start repairing tissue or transmitting signal. So it's always got me very excited. And well, that idea of nanobots is still confined to science fiction, but we're breaching the border that's maybe in some near future we can create some real life nanobots. And that's kind of led me through my education and through my career to become that person that create real nanobots.
Cool. So are you creating nanobots?
Well, I work on a multifunctional particles, nanoscopic multifunctional particles that can make multiple function in the body, like sensing or therapy. We also call it theranostic devices. Well, we sort of can manipulate them, but it's still not what you see in science fiction movies where you have these intelligent nanobots in the body.
Not yet.
Not yet.
We will get there. Okay. Where does your research fall in this giant domain of materials or nanoscience?
Yeah. So my field of research is obviously nanoparticles for biomedical applications, where I work with nanoscale particles as a platform for capturing or measuring or understanding information on molecular and biological processes. So my research goal is to develop these novel nanosensors that will have this superior biomedical functionality like a nanobots, and that application would include imaging and non-invasive diagnostics of diseases.
All right. I think we understand now where you fit in the giant puzzle. Thank you for the explanation of that. We are curious to know if you have like a favorite research project or a research project that you're proud of, and we would like to hear about it. And could you explain it to us in very, very, very simple words in the section we call In Other Words?
So I've thought a lot about that, and I manage several projects at the same time, and I'm proud most of them. So I cannot choose my project that I'm super proud, but there is one project that I like to brag about, and that's because it's currently coming the closest to commercial product. It's about easy and non-invasive detection of celiac disease, also known as gluten intolerance. In simple words, my team developed a method to screen for celiac disease by simply mixing a bit of your saliva or patient's saliva with nanoparticle-based solution in a small tube. And the color change, which can be detectable by naked eye, will tell you about presence or absence of that condition. So I hope to see our development and this particular celiac disease diagnostics to be transferred to a product that will be available over the counter from pharmacy or in the clinics and be available in the same way like currently pregnancy tests been available for decades on over the counter.
Wow, this is science fiction becoming reality. We talked about
I wouldn't call it science fiction, but yeah.
well, with nanobots, I mean, they are not inside your body, but they are still helping the inside of your body from the outside. So we are getting closer. Wow. Wow, how I'm looking forward to seeing those devices, detection devices, can we call them? Tiny nano devices detection tests for gluten intolerance. This is see, this is amazing, amazing. All right. Do you teach? Do you deliver lectures to students? And if you do, would you like to mention a few, or which one would you like to mention?
Currently, I mostly give guest lectures to undergrad students. I teach in area of nanobiotechnology from basics to application of nanotechnology in biology. Also, another side that I focus for lectures is in vitro diagnostics, which means diagnostics that's sort of like pathology lab diagnosis using nanotechnology.
Right.
And as well as lecturing about medical device regulations to students.
Okay. Wow. Your whole field of research is so fascinating. If every lecture that you mentioned sounds interesting, and I hope I can sit in one of your lectures at some point. Would be cool to hear it from the experts. Okay, let's go a bit away from teaching and let's go more in the research experience domain. I'm 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 hoping that you're already having a lot of fun and everything is going smoothly for you in your research. However, if you had three wishes to improve your research experience, what would you ask for? And I'm not promising anything.
So from my research project point of view, I wish to see that novel nanoparticle technology developed in our lab will be translated into real life applications and products. So as an example, I hope to see that diagnostics I was talking about will be transformed to the product and will be available over the counter or in the clinics or hospitals, and people start using that. So it's research that not end up in research papers, but has real impact on human life and human health. From academic point of view, I wish that academics stop judging other academics based on the research paper, number of research papers they published and their H index, and just counting how many citations you have. It's not a number of papers that you have published, it's impact of your work on societies, in my opinion, is more important. And my third wish from personal point of view is as a beauty pageant contest would say, world peace and stop climate change.
Well, I imagine using nanotechnology to tackle climate change at least. Peace, Well, for that, we can't probably use nanotechnology, but maybe there would be a research field or a domain where it's like nanotechnology for peace. That would be
Oh,
interesting.
yeah, we can open a new field.
Yeah, where we tell people about cool science and then everyone calms down and stops fighting. That would be
Yeah.
cool. Yeah. Okay, those three are I agree with all three of your wishes, and they're fair. I wish I could grant them, but I can't. But I will keep my fingers crossed that at some point, I hope we are moving in the right direction at least, and at some point we will achieve what you have asked for. All right. Um, would you like to tell us what are you looking forward to in the next 3 months of the year?
Well, definitely we're coming to holidays time, and I'm really looking forward for holidays and spend time with my family. It's been really hectic and exhausting here
Uh-huh.
in my career with many ups and downs. I need some time out
Mm-hmm.
to recharge and get ready for the next round.
Okay, that seems fair. All right. And before we wrap up, would you or could you outline for us the challenges which are faced by the materials and nano field, scientifically, societal, or any kind of challenges that you would want to mention?
So nano challenges. So because I work in nanobiosphere, the biggest challenge in nanobiotechnology is translation into clinical and health practices.
Mm-hmm.
Uh, so basically, how we can commercialize this nanotechnology-based devices into society. There is a lot of perception in public of how bad nanotechnology for us with nanotoxicity, nanoparticles in food, cosmetics, in the air, but kind of painting nanotechnology as a bad guy
Mm-hmm.
and not looking into bright side of nanotechnology. So I think the current hurdles limiting periods of nanoparticles on the market, it's because of we still don't have basic understanding of interaction nanoparticles with biological matters like cells and tissues. So really some basic questions,
Mm-hmm.
but we're also facing really translational nanotechnology into large scale manufacturing,
Mm-hmm.
safety, intellectual property, and in biomed sphere is government regulations such as FDA, TGA, and other regulatory pathways.
Okay, all right. So first we need to educate. One thing is to educate the public about the good that is nano science is or nanotechnology is for medicine, for
Yes.
biomedical biosphere, as you mentioned, and also address the rules and the regulations from the government to make it
Yes.
smoother to bring the products from the lab to the pharmacies nearby
Yeah.
us. Okay, interesting. Well, thank you very much, Olga, for speaking with us, and we see you on Twitter then.
No worries.
Thank you for listening. To know more about us, please visit our website, realscientistsnano.org, and follow us on Twitter at realsci_nano.